Hi, I'm Susan Gray, and this is my speech on the nursing industry's staffing shortages and some solutions to help fix the issue. A nurse told the parents of a newborn, "You have a cute baby." The father said, "I bet you say that to all the babies." "No," she replied, "just to the cute babies." The father asked, "So what do you say to the others?" The nurse replied, "The baby looks just like you." Almost any time you have been to a doctor's office or hospital, a nurse is the first person you usually see. They are your face of care for the majority of your time in the facility. As a child, I watched MASH and I knew I wanted to be a nurse, so I joined the Army. I've been in this job for about 20 years, and I researched it thoroughly for this paper as well as furthering my education. Nurses are needed worldwide. According to Gail Morris in the Nurses Journal, nurses do much more than perform medical tasks. You can really make a difference in someone's life. And then in the International Nursing Review, Micah Peters addresses this issue, saying nursing shortages are common, widespread, and have been persistent for most of a century. There is a global shortage of nurses due to many different reasons, which is devastating to society. I'm going to talk about the nursing worldwide shortages, the factors that are creating this issue, and some issues and some ways to help address the issue, some solutions for the problem. This is a brief overview of what I will be talking about. Now we are going to discuss it in further detail. For over a century, the world has been facing global nursing shortages. The worldwide supply of nurses is dwindling and not meeting the demand the world has for the services the nurses provide. Andrew Blake Hendrickson stated in the International Journal of Managerial Studies and Research, nurses are a vital part of almost every part of the healthcare industry. The aging population is creating problems both with the number of elderly people needing care rising and the aging of nursing staff retiring. It is especially problematic for the low-income areas because this is where a lot of the elderly population reside. The shortage of nurses is going to decrease the care needed for critically ill or injured patients. Burnout due to long work hours, nursing staff shortages, and improper balance of work-to-life ratio is another contributing factor. The staff is overwhelmed by poor distribution of doctors and nurses to the patient ratio. They feel unable to face the demands the job brings due to the lack of staffing. This can cause delays in treatment into patients and more errors and accidents in patient care. COVID-19 is creating more work for the already shrinking nursing force. Micah Peters addresses this in the International Nursing Review. The pandemic is the latest major threat to the nursing field shortages. New nurses and potential nurses and nursing students saw how badly the medical field was hit by the pandemic. Many practicing nurses were severely affected by COVID-19 in many negative ways, either by contracting the virus themselves or by facing long quarantine periods because of their proximity to infected patients. The pay disparity in nursing is also another huge factor. Nurses are paid on average 3 times less than doctors, even though the nurses provide most, if not more, care than the doctors do. Between burnout and wanting better pay and benefits, nurses in the field are choosing new careers outside of the medical world. All of these issues create a decrease in staffing. Nurses have lots of positive things that draw people to the field, but the reality is the negative being shown in the media, the word of mouth of the practicing nurses, as well as overall dissatisfaction with the job are creating people to look for more lucrative careers in other fields. I just explained about nursing shortages and some factors contributing to the shortage. Now we'll go over some solutions to the issue. The problems faced by the nursing shortages will not be fixed by one great solution, but by many small changes worldwide. Offering higher rates of pay with smaller gap between nurses and doctors' pays, adding more benefits to their pay, like better health insurance, vision, dental, mental health insurance, and offering more time off options will help alleviate some of the issues, as well as making sure that the nurses get their proper lunches and breaks by keeping better timekeeping strategies, making sure to have rotations and not miss people during the rotations. These can help alleviate some of the problems the nurses face with not getting breaks. Also adding to the staff by hiring assisting staff such as certified nurses assistants, patient care technicians, and medical office assistants and medical assistants can help alleviate some of the workload that the nurses face. As I'm finishing my speech, you can see that there are many problems with nursing retention, and the factors contributing to it are very large. I have gone over the issues of the nursing shortage, many factors creating the issue, and addressed a few solutions to the problem. The world is facing a nursing crisis due to extreme worldwide shortages, which is very bad for society. In the paper, Registered Nursing in Crisis, 51% of the nurses were considering leaving the profession within the next 12 months due to unsafe staffing. In this graph, we talk about the unsafe staffing, the 51%. 93% are experiencing moral distress while on the job. 30% report that the staffing is based on patient needs, and 15% say nurse-to-patient ratio in their unit is safe, which leaves 85% unsafe. I don't like those odds. According to Peters, in the International Nursing Review, by 2030, there is likely to be a global shortage of 13 million nurses. Do you want to face a picture of healthcare without nurses in it? I know I don't.